Good morning, everyone. Thank you so much for joining today's webinar regarding the 2020-2021 CalMedForce application cycle with an open application period of August 7th through September 21st, 2020. My name is Robin Simpson, and I'm the CalMedForce Program Director at Physicians for a Healthy California. My colleagues and I hope to answer all your questions about the CalMedForce application, which funds graduate medical education residency positions. We do have a lot of information to cover in today's webinar, and we'll have an opportunity to answer any questions you may have at the end of the slideshow. If possible, please do hold your questions for the end. All participants will be placed on mute during today's webinar. You may submit your questions through the chat function, and our team will monitor the questions and address all questions at the end. Please note we are recording today's webinar. We will post it to PHC's website by the end of the week. We are holding the following two webinars, one today and one more webinar on September 9th during this application cycle. We already held two prior to today as well. However, please feel free to let any of your colleagues know there will be one more webinar, live webinar, I should say, after today, and they can sign up for that webinar on September 9th on our website at any time, and that website is phcdocs.org. Here's our agenda for today's webinar. Joining me on the call today are my two colleagues, David Kurt and Victoria Chesley, both program analysts here on our CalMedForce team. You'll hear from both David and Victoria a little later. We will cover CalMedForce's governance, an overview of the program and application, walk through the application process and steps, and address some frequently asked questions. There will be time for question and answers at the end. Once again, please feel free to submit your questions through the chat function. Here is the CalMedForce mission. We are committed to growing a diverse physician workforce by supporting, incentivizing, and expanding graduate medical education in California. Our goal is to grow and strengthen the physician pipeline to meet the demands of California's growing patient population with a focus on medically underserved areas and populations. Our governing statute is Proposition 56, which California voters approved in 2016. It was sponsored by the California Medical Association, California Hospital Association, and Service International Employees Union, United Healthcare Workers West. It allocates $40 million of funding towards graduate medical education to sustain, retain, and expand California residency positions in primary care and emergency medicine. The University of California is the designated recipient of the funding and contracts with PHC to administer the GME grant program, CalMedForce. This slide shows the section of Proposition 56 that governs our program. At the top, Part C states that $40 million will be provided to UC with the goal of increasing the number of primary care and emergency medicine physicians. The funds are to be used to sustain, retain, and expand graduate medical education programs. Part 1 defines primary care to include internal medicine, family medicine, obstetrics, gynecology, and pediatrics. Part 2 says that funding is to be prioritized for direct medical education costs for programs serving medically underserved areas and populations. Part 3 states that all accredited allopathic and osteopathic residency programs in California are eligible to apply. Part 4 states that we are to conduct annual reviews of statewide physician shortages and that funds may be used to address such shortages in other specialties. CalMedForce's governance structure also consists of a board of directors and an advisory council. Our board consists of representatives from these 5 organizations: Physicians for a Healthy California, California Medical Association, University of California Health, California Hospital Association, and Service Employees International Union. Our advisory council consists of medical professionals and graduate medical education subject matter experts from these 15 organizations. The advisory council is involved in decision-making surrounding our application process, eligibility, awarding process, and monitoring. We work in close partnership with our advisory council and our board throughout the year. All right, award criteria for the CalMedForce program. It was summarized in the statute, but these are the main points. Eligible residency programs must be located in California, can be either allopathic or osteopathic, must be in primary care defined as family medicine, internal medicine, OBGYN, or pediatrics. Emergency medicine is also eligible. Programs must be accredited by the Accreditation Council for Graduate Medical Education by the time of contract execution. I do want to stop and comment on this bullet point for a moment. We have some programs that are currently in the process of accreditation, specifically some family medicine programs who are undergoing the review committee process. So they may not have an official letter of accreditation or a future accreditation date ready by the time either early submission or final submission deadline approaches. Please contact us. We can work with you to determine what type of documentation would be appropriate for the step on the application that asks for this documentation. And once again, we will be able to accommodate you because you just have to be accredited by the time of contract execution, which is in July 2021. And programs are prioritized that serve medically underserved populations and areas. Here's our available funding by discipline for this application cycle. Family medicine has $9.95 million available. And if you saw previous webinars, this number did go up slightly. We actually did add in the balance of funds from an awardee who lost accreditation. It was a family medicine program. So for this application cycle, that money went back into the family medicine bucket. So there's a slightly larger amount of family medicine funds available for this cycle due to that program's loss of accreditation. Internal medicine, OBGYN, pediatrics, and emergency medicine each have $7.125 million available. And these funding amounts may vary annually and are voted upon by our advisory council. Programs can apply for funding by residency type. Programs can apply for up to 5 positions. $50,000 per resident per year is awarded for existing programs. $60,000 per resident per year is awarded for expanding programs, and $75,000 per resident per year is awarded for new programs. And there may be some combinations that are possible that programs can apply for. For example, a residency program can request 4 residents that are existing and 1 resident that is expanding, as an example, for a total of 5 resident positions requested. A couple of important dates to remember are as follows. Our early submission deadline is actually tomorrow, which is Friday, August 28th, 2020. So applications submitted by that date, by 11:59 p.m., are considered a part of our early submission period. This is something we really want to emphasize and encourage programs to take advantage of, because if your application is submitted by tomorrow by 11:59 p.m., it will undergo a review by staff, and we will give you a chance to correct any errors or any missing data, whereas applications submitted after that deadline will be considered final and no changes can be made. So it's definitely in programs' best interest to be able to submit early and have that chance for a preliminary review by staff. Our final application deadline is going to be September 21st, 2020 by 11:59 p.m. Couple of changes we want to make folks aware of that's different from last year. We'll be asking for 5 years of graduate data instead of 3 years. So you'll need to have that ready when you open up the application. We will no longer be asking for paramedics for the secondary training site, only the primary training site. And potential applicants can apply now as long as they will have ACGME accreditation prior to contract execution in July 2021. Getting started. So applications must be submitted electronically. No paper applications are accepted. Each applicant must create an individual account with a username and password. If an applicant applied previously in previous years, you can reuse the username and password from a previous year. Not all of the information from the previous application is saved. Some hopefully will import into your application, but some fields do not, so just be aware of that. And be prepared with information on 5 years of previous graduates. Other things you'll want to have prepared are the accreditation documents. You'll want to have the sponsoring institution letter of accreditation, as well as the residency program letter of accreditation, or as we state here, a letter of decision providing proof of formal accreditation by contract execution, if applicable. If that applies to your program, you're in the process. And as I spoke to earlier, if you don't have that, but you are in the process, it's just you're too early in the process, please reach out to our staff. We can discuss what documentation you can submit. Please have your payer mix data prepared. You'll need to enter that on the application, as well as budget information for both your residency program in general, as well as the planned use of funds for the grant. At this point, I'm going to turn it over to my colleague, David Kurt, and he's going to go into more depth about the actual steps on the application.
Thank you, Robin. So we'll be going through the steps of the application in depth. So first, I'd like to point out where the application location. And so basically, you want to visit phddocs.org or CalMedForce.org. Either one will send you to the same place. You're going to see a splash page. Under programs, you want to go down to CalMedForce. And when you click that, it should send you to a page full of resources. And also under that highlighted green square, if you click that, it can also send you directly to the application itself. So under that splash page I was talking about, we have a list of application resources. So application resources will be your grant guidelines for this cycle, and that's going to be your bread and butter. That's something you'd want to refer to when you're filling out your application. It has tons of helpful information, along with our frequently asked questions. So I do encourage you to take a look at that for any questions you might have, because the answer might be readily available for you. We also offer an application tutorial. So basically, it's when you click on it, it's going to share a video with you, and it's just going to go through. It's kind of like a walkthrough of the application. So that video may also help some applicants as well. So we also offer a copy of the blank application, so you can kind of anticipate what we're going to be asking. Also a sample completed application, so you can get kind of an idea of what kind of answers we're expecting. We also offer a sample agreement. So if you are awarded, this is the agreement that you'd be most likely to be signing. And as well, we also have a separate web page for webinars, such as the webinar you're in right now, but also other webinars we may have in the past or future. So there are a couple application resources, other things I would like to point out. Now we're going to go into depth at these in the next couple of slides, but just to share with you, we have rollover informational icons that will share additional information. And we also brought back again that request help button, which is a feature that allows applicants to send questions directly to us, and we'll be able to efficiently answer them. So in the informational bubbles in particular, when you hover your mouse cursor over the bubble or you click it, a tan pop-up window will appear. Some other platforms, that tan pop-up window might be more yellow. But anyways, you'll see it almost look like a little sticky note. And next to it will be the words with relevant explanations or definitions next to that word or sentence. As for the request help button, when you click on it, you're going to have a pop-up window appear. Your residency program name will auto-populate at the top, as well as the email you use to create your username and password will be there as well. We also offer an option of an other contact cell, so you can add a phone number or a different email address which you may want PhD to contact you. Also on the far right of this pop-up window, you're going to notice a step, and it's going to have the step is going to be auto-populated there. So let's say if you are on step 13, you have a question about it, it will automatically pop up there. And then at the bottom, you can go ahead and type in your question. And when you're done, you just click send question, and we'll take a look at your question and answer it within a timely manner. So just as an FYI, you can move to the next step of your application by clicking Save and Continue at the bottom of each step. So at any time, you can turn to any of the completed steps you want, meaning you can tabulate backwards, but in order to move forward, you will need to require to click Save and Continue. And the only reason why we do that is to make sure the information you might be including or adding in addition to will be appropriately saved. And speaking of that, every time you click the back button or the Save and Continue button, your progress will be saved. And what's also nice is you can leave at any time you want, and if you want to come back and continue your application at a later time, you'll start off right where you left off, as long as you're logging in with the same account. And also, just to reiterate, there's only one application submission per account. So this information here is just reiterating what we just had in the previous slide, but I would like to point out to you is to download my application. So anytime in the application, you can download your application and it'll generate a PDF for you. That being said, it's only going to have the steps filled out to what you have completed. So if you're halfway through, let's say on step 5, and you click download my application, it's going to just show whatever information you completed through that step, and the rest will be blank. But it is available to you. So the process to logging in. So we have once you're ready to log in, you can either use a username password that you had, and prior applicants can use their logins from previous cycles. And just to reiterate, some information from previous cycles may be auto-generated into your application this cycle, but not all of the information. New applicants will need to click the register button to create an account. Now that being said, if you forget your username, or you may reach out to us or click the register button just to register a new account. Now, however, if you just forget your password, you can click the reset password button right next to it, and that will prompt you with instructions on how you can reset your password. So step 1 here, we have a click a preview of the blank application. So the preview is actually going to be spelled out as download a PDF version of your application. Basically, when you click it, it's going to be a blank application, of course, because you didn't start anything yet on step 1. So when you do click it, it's probably going to come up completely blank. Speaking of step 1, what we need to take a look at here is you must check all the appropriate boxes for eligibility criteria. So the first 4 boxes will have to be clicked in order for you to move on. As for the final box, if you serve medically underserved population area, go ahead and click that. We made that box optional. So speaking of, if for whatever reason you didn't fit the 4 checkboxes, like fill out that criteria, if your residency program doesn't meet the following criteria, but you still think you're ineligible, we ask you to provide a detailed yet succinct explanation, and CalMedForce will reply within a timely manner. So, and this is just if you think your program, if for whatever reason, if it does not meet the criteria above, but you still think you're eligible, go ahead and please provide us an explanation. So step 2. So step 2 is we just want to know how you heard about this funding opportunity. And speaking on that, all the data collected is just used for internal purposes only. We just want to know how you heard about us. So when you click one of the checkboxes on the left, it might prompt another set of checkboxes. So in this example, emails, it's going to say select email options. Did you get it from CMA? Did you get it from us directly, or maybe some other source? Did you get it from social media, and so on. And also on step 2, you'll start seeing the request help button here, and you'll see it at the bottom of your application from step 2 and here on out. So step 3, so if your residency program applied in previous grant cycles, these cells will start auto-populating once you start typing. So What it is, it's gonna be like a predictive text, so it's gonna be all highlighted as you type out your program, and it should come out as a drop-down menu for residency programs. As for sponsoring institution, it'll just be predictive text. Now, for whatever reason, if your program is not listed in here, we do provide an other, and then we just need you to describe or actually name your program in the other if you can't find it. So step 3, continued on that, we do need you to upload the most recent accreditation letter from the appropriate accrediting approval body, which is ACGME, for the sponsoring institution and the residency program. However, if you're not yet accredited, we please do ask you to upload a letter of accreditation decision or something very similar to that, but it has to be from ACGME, and it's just providing proof of future accreditation. That being said, so on step 4, we have our email, and just speaking on the email and telephone, it cannot be the same for the primary contact and program director. So we have your primary contact here, which just describes the first, middle, and last name, your primary contact's title, the address, and we do offer a secondary email and secondary phone number. Now, these fields are optional, but however, if you have an alternate way for us contacting you, that's perfectly okay. Okay, so we also have on step 5, we're talking about the primary site. So we're going to see a bigger picture of step 5 here, but I just wanted to kind of zero in on the HPSA. So here we're asking, is your primary training site in a primary care professional shortage area? So HPSA, we either ask for geographic HPSA or an automatic facility HPSA. So you can click yes or no. And if it is located in your HPSA, we just ask you to punch in your score below. And we also give you a web link so you can locate your HPSA score. So I'll continue. This is what I mentioned. So in the middle is just kind of the snapshot that we just talked about. So applicants can use the HPSA linked above to find out if their program, what their program score is for, program HPSA score. On the far left, we're going to ask the indication of your the location of your primary ACGME approved training site, or the primary training site where the majority of the primary care or emergency medicines, their FTEs of residents are providing care. So we're going to ask for the name of the site. We're also going to ask for the practice setting. We'll go into a little bit of detail about that, as well as the address. And on the far right, we're going to ask for the payer mix. Now, just to note, this cycle, we are only asking the payer mix of the primary site. So if there are previous applicants from last cycle, we did ask for a secondary site. However, for this cycle, we are no longer asking for secondary site, just primary. And so we're asking for a percentage of Medi-Cal, dual eligible, indigent, uninsured, and other payers, and it will auto-calculate 100% at the bottom. So step 5, continue. This is the talking about the practice settings. So we have a drop-down menu of several practice settings for you. Please choose the one that identifies your training site. Now, we do understand there are tons of practice settings. So if for whatever reasons those don't fit your criteria, you can click other, and please describe to us what your practice setting is. So here we go. We're going to define program type by new, expanding, and existing. So for CalMedForce, our definition of a new program is a program that received ACGME accreditation for both the sponsoring institution and the residency program, or the residency program will have program accreditation at the time of contract execution, and has not graduated any residents, and will enroll at least one class by July 1st of 2021. Now, expanding program, I know that's a lot of text to look at, but I'll try to break it down for you. So expanding program is an existing residency program that has received ACGME accreditation, has graduated one or more cohorts of residents with additional categorical residency positions, as evidenced by the letters from ACGME, which approves for a permanent or temporary increase in the number of resident and positions, and that's effective after July 1st, 2020, or has ACGME residency positions that were not filled during the 2019-20 and or 2020-21 academic years, and plan to fill all or perhaps some of those positions in the 2021-2022 academic year. As for an existing program, we sustain those programs, so that this is the definition for just existing. So residency program that has received ACGME accreditation, and you've graduated one or more cohorts of residents and will have the same or fewer number of filled positions as the 2020-21 academic year. So in step 6, this is basically describing those program types right here. So if you click the first checkbox, it's probably indicative of being a new program, right? Second checkbox is indicative of those expanding, or as well as existing if it's a third checkbox. So what's highlighted here, if you fit this parameter here for an expanding program, you have to choose a file. When you choose a file, upload, it will attach a file. You'll be able to use the red remove button. So this is very similar as adding your other accreditation letters. So once you do add it, we do ask you to click a blue upload plus file button. And this is indicative of the same one that you've done earlier. So once you click that, it'll upload the appropriate documentation, and then you can press save and continue. And we do offer an ACGME approval for expansion as an example, and that's highlighted in blue right underneath this. If you click that, it'll show you what that letter may look like. So on step 7, so these boxes on the far left, new program expanded and existing, so these boxes will automatically be selected based on the answers you gave us from step 6. So, if you're a new program, it'll automatically highlight the new. If you're an existing program, it'll have the existing one checked off. If you marked off that you're expanding, both expanding and existing will be available to you. And the reason why that is some existing programs may also apply for expanding slots. So if you're an expanding maybe one slot and you're asking for existing positions, that's the example they have here. So you can ask for any combination of those if you're an expanding program, as long as the maximum allowed is 5. So as long as that combination is 5, you're okay. So it's 5 positions or less, right? So the center column, you have your amount per position allowed, and that is going to be grayed out for you. You don't need to do anything. That just shows you what it is. And then you have your duration of your residency program, which is 3 or 4 years. Now, let me note for you that this should be automatically tailored to whatever your program is. So if your program is a 4-year program, it should be labeled here, but please do take a look to make sure it's appropriate. So it's going to measure out, let's say, an expanded position. We have one at 60,000 for 3 years, would be 180,000. So the total requested here, you can see is grayed out, will also be calculated for you here. And now I would like to turn this over to my colleague, Victoria.
Thank you, David. Hello, my name is Victoria Chesley, and I will be going over the next couple of sections of the application. The next 6 slides will go over information pertaining to step 8 of the application. Step 8 will request projected costs for the residency programs for academic year 2020 to 2021. Please make sure to pull all of the costs for running your program into the boxes. Please also note that the section labeled Other Costs will be calculated from a table below. This table will be shown in a later slide. Before we move on to the other portions of Step 8, I want to mention our allowable cost document for the CalMedForce program. This document is known as the CalMedForce Allowable Costs for the Use of Graduate Medical Education. This document will go into further detail on what purchases are allowed with the CalMedForce grant. If your program is awarded, we follow a reimbursement model for the distribution of funds. And additionally, grants must be used exclusively to support costs directly associated with medical education. Overhead costs are allowable and may constitute up to 10% of the grant award amount. Furthermore, grants may not be used on items not directly related to their program, and there is a 10% cap of the total grant award for the purchases of medical equipment. For complete details, please see our allowable cost document. Now, with the discussion of allowable costs finished, we can go back to Step 8. This section of Step 8 will collect information on how your program will use the funds requested from the grant to support your residency program. We know funding allocation may change during the course of the residency program, so this section will be used for internal purposes only, and this will not serve as a binding budget if your program is awarded. Once the funds requested are completed, they will be auto-calculated. Please note that the requested funds must match the total. Finally, for step 8, your program can list other costs for running your residency program. These costs can include things like licensing, match participation, and other administrative expenditures for general items that support the operational needs of the GME program, and in-training examination fees. Step 9 will request information regarding the number of positions available and filled for academic years of 2015 through 2016 to 2020 through 2021. Please note if your program is new, you can enter 0 in the appropriate fields. Step 10 is a continuation of Step 9. Please provide additional information on your graduates from 2015, 2016, all the way through 2019, 2020. If your program is new, you can skip this step. Additionally, for Step 10, if you have a different number of ACGME approved residency positions than filled positions, please explain why in the text box. For Step 11, this is where general program information will be sent to if you were awarded the CalMedForce grant. Step 12 is optional for your program to complete and asks if your residency training program has a diversity strategy. These can include things like a formal policy and training activities that explicitly aim to promote diversity in residency training programs. If you selected yes for Step 12, you can check one of the boxes that closely aligns with your diversity strategy. We have also included a text box where you can explain your answer. Step 13 is the submission step of your application process. Please read and check the attestations in this step before moving forward with the submission process. The residency program and date will auto-populate, and please note there is only one submission per account. Once you click Save and Finish, you can review your application before submitting. Additionally, after reviewing your application and scrolling to the bottom of the page, you can submit your online application. If you wish to review your application to make changes, you can do so by selecting No, Return to Application. Please note, once you have submitted your application, no further changes can be made unless you have submitted before the early submission deadline, which is tomorrow at 11:59 p.m., and the changes are deemed appropriate by the CalMedForce staff after review. Finally, once you have submitted your application, you can view your preliminary score and download a PDF version of your completed application. Now that we are done with the application process, we can move on to the grant review process. There are several points to be made for this process. Each application will be auto-scored, and applications will be scored based on CalMedForce's scoring matrix, and please see the grant guidelines for additional details. Additionally, applications are ranked relative to other applicants in the same specialties. So for example, if your program specializes in family medicine, then your program will be ranked against other family medicine residency programs. CalMedForce has the option to award full, partial, or no funding to an applicant based on the applicant's score and ranking within their specialty. All applicants will receive their final score following the close of the application cycle, and award announcements will be made in late November or early December of 2020. The following 4 slides will go over common applicant questions. So the first question, can I access my application to make changes or updates after I submit? Unfortunately, no. Once you submit your application, it will be considered final and no supplemental information or changes can be made to the application once it is submitted unless you submit it before the early submission deadline, which again is tomorrow, August 28th. The next question is, what if the sponsoring institution has more than one program? And so each program must submit their own application for consideration. For example, if your institution had both a family medicine and emergency medicine residency program, then they must submit their own separate applications for the grant. Next, if a program was awarded last cycle, can they apply again for this cycle? Of course, if your program was awarded last cycle, you remain eligible to apply again for fiscal year 2020 through 2021. Other commonly asked questions are, what if my program was not awarded last year? We encourage all previous applicants who were not awarded last cycle to apply again this year if they are eligible. The next question, how are the applications scored? All applications will be auto-scored out of a total of 30 points using the criteria and scoring system established by the Advisory Council and Board. Please note you can find the scoring matrix in the grant guidelines for specific scoring details. Next question, who should apply? And we encourage all eligible programs to apply. Moving on to more commonly asked questions, what is the contract terms date? So contracts begin July 1st, 2021, and would be for the duration of the residency program, and that duration is either 3 or 4 years, depending on the length of your program. If not awarded, is there an appeals process? And unfortunately, no, all award decisions are final. With this in mind, we do strongly encourage applicants to submit before the early submission date so your program can make any necessary changes. And of course, please contact the CalMedForce staff if you have any specific questions. The next question, when is the first payment? Grant payment disbursements will begin in fall 2021. And so this is the last set of commonly asked questions. So can there be contract changes? Unfortunately, no, the awardee agreement is non-negotiable. If you have any questions about the awardee agreement, please contact CalMedForce and we would be happy to answer any of your questions. What are the costs acceptable under this grant? Per the Proposition 56 statute, costs must be related to direct medical education costs. As previously stated, we created an allowable cost document with full details, so please see the document for more information. And lastly, why is it important to submit my application early? Applications submitted by August 28th, 2020, 11:59 p.m. will have the opportunity to edit their application if deemed necessary following staff review. Applications submitted after August 28th, 2020 will be considered final and no supplemental information or changes can be made to the application. So this will give an opportunity for applicants to correct any mistakes they think may be impacting their score. Thank you for your time, and I will now pass the presentation back to Robin.
Thanks, Victoria. All right, I'm going to touch upon some common mistakes that we have seen in previous application cycles. And number one is definitely not taking advantage of the early submission deadline. Once again, as each of my colleagues and I have mentioned, during early submission, if you submit by tomorrow, August 28th, by 11:59 p.m., we will review those applications for completion and errors and reach out if programs need to make any corrections. However, if an application came in anytime after August 28th, it will be considered final. So it's definitely in programs' best interest to submit by the early submission deadline. So all of you listening still have the opportunity to submit early. Second biggest thing that we see is uploading the wrong documents or uploading duplicates by mistake. So we encourage you to just take extra care on the steps that require uploading documents. We've seen, for example, people uploading the residency program accreditation twice, whereas you are asked to submit both the sponsoring institution and the residency program letters. We've seen the incorrect letters from ACGME, so just definitely take extra time to ensure accuracy on that step. Next one is not being clear enough in the budget description. So we are looking to ensure that you will be adhering to the allowable costs permitted by CalMedForce. So be sure that you're providing detail and that we don't have to, kick it back to you and say, hey, this doesn't look like it's within our allowable costs. And once again, that allowable cost document is provided under applicant resources on our website. And finally, not asking questions. Please, if you have any questions, do reach out to us. We're here to address them. I see we have some coming in on our webinar today, so we'll get to those in just a moment. And we're also, of course, available by telephone and email as well. Our grant does have reporting requirements, as all grants tend to have. So our reporting requirements are primarily these two documents, a semi-annual review and an annual review, and that will be for each year of the grant. You will submit these documents. So this is how we will ensure that your program continues to be eligible for the CalMedForce grant, and also for us to capture what's going on with your residency program in terms of how the grant is impacting you, successes that you're experiencing, challenges that you're experiencing. It's a wonderful ways for us to sort of capture the impact of CalMedForce on residency programs across California. The semi-annual review is sent out in approximately December of each year, and the annual review is sent out in June of each year. So you will have the expectation to complete these reports, which also have a financial component, asking you to document how funds are being used. In summary, just a couple of final points. Application dates to remember. Once again, our early submission deadline is ending tomorrow, August 28th, 2020 at 11:59 p.m. So tomorrow, get those applications in early so that our staff has a chance to review. If you don't make it tomorrow, don't worry, our cycle closes September 21st, so we will be accepting applications until September 21st, 2020. We suggest that you gather the documents prior to starting the application, so you'll be able to complete it in a timely manner and be able to have a very complete application. And once again, please take advantage of the supporting materials that we've provided on our CalMedForce website, including the grant guidelines, sample contract agreement, sample application, and so forth. This is our contact information. So this is definitely available to you. Once again, our website, calmedforce.org. Reach out to us by email, calmedforce@phcdocs.org, or our telephone number, 916-551-2899. And of course, our website as well. Lastly, here is our staff contact information. You may reach out to any of us individually. On the call today was myself, Robin Simpson, as well as David Kurt and Victoria Chesley, program analysts. Listening in is also Jennifer Turner, our Senior Director of Operations, and we will actually unmute Jennifer in just a moment to assist with any questions that came in during our webinar today. So with that, we thank you so much for listening today and for considering applying for CalMedForce funding. I'm going to open it or turn it over to David to read the questions that have come in, and we will address each and every one of those. Also is a great time right now, if a question is popping into your head, please feel free to type those questions into the chat function right now. All right, David, any questions?
Yeah, so the first couple of questions I see is from Ms. Gonzalez. She says it seems like you can't move forward on the application unless you fill in all the fields on the current step. For example, you can't add budget information until you have finished the payer mix information. Is this correct?
I can respond to that. Sandra, that is actually correct. You could proceed forward in step and save and go back to the application, but unfortunately you can't go from a step 10 to a step 12 without completing that. There are some hard stops in the application itself. It is something that we did notate and we will revisit for next cycle, however.
Right. So the second question we have here from Ms. Gonzalez is if the primary training site is not HIPSA primary care, but is listed as a medically underserved area, what is the difference in these two designations? Does MUA, MUP count for any scoring in the application?
Very good question. So with medically underserved area and or population, that's a particular area that we focus on through Proposition 56. Within the application, there's a few opportunities to receive points for a program that definitely doesn't qualify under HIPSA, but may qualify under a priority county. So when completing the application, an applicant or program can qualify, again, in two fashions, and they are an and or an or. So with the HIPSA, that addresses the health professional shortage area, and within the application, you can determine if your program has been deemed as a HIPSA area, and if so, you can certainly pull your respective score from that website. However, there are occasions when certain programs, again, are in a medically underserved area but don't fall within the HIPSA guidelines and are not scored. In that situation, they can qualify for a priority county. So there are 3 levels that a program could be awarded points for within the priority county, and that is done behind the scenes. So rest assured, more than likely your program will receive the point value, as all programs within the California, or all counties within California are in the priority counties, and some just receive more points based on the location. So if your program is HIPSA and in a medically underserved area or population falling within the priority county, you can actually get points in both areas. Another area we look at, just to kind of reiterate, really focusing on medically underserved areas and populations, is the payer mix. So a payer mix can also help support point value. But great question, Sandra.
Okay. And then I got one more from Ms. Gonzalez. If your program is starting in July 2021, what should be entered under the program budget? Can projected first-year costs of operating the residency program be entered here?
Yes, I believe that is what we are asking for programs that are new, is the projected budget for the residency program. So that'll be a question that comes up from new programs that have not yet had 1 year of operation. All right, any other questions, David?
No, Robin, I don't see any more questions come up just yet. So I think that was all of them.
All right. Thank you all for listening today. Once again, our recording will be available. And of course, we're available by email and telephone as well. Don't hesitate to reach out. We'll be definitely keeping an eye out today and tomorrow for any questions that come in through our voicemail and email inbox, since that early submission deadline does end tomorrow. So don't hesitate to contact us, and we encourage you to finish up those applications by tomorrow evening. Thank you all again, and thanks to my colleagues for assisting, and we look forward to hearing from all of you.